Welcome to the Bloomington Rotary Club's weekly celebration of service for April 13th, 2021. I'm your current president, Ashley Wesley. Thank you so much for being here. Natalie, please show our flag for 15 seconds of respectful silence. We ask that you remain on mute and take this time to personally reflect. Thank you. Now I'd like to introduce Tim Jessen, who will offer our reflection.
Good afternoon. Deciding on a topic for reflection is more difficult than writing it. I was pressed a little bit to do this one, and I thought, well, I'll just find the topic later, and I did. Today is the first full day of Ramadan, the annual Muslim celebration that includes day-long fasting followed by a feast at the end of the day. I'm not a Muslim, but I celebrate the Muslim community here and worldwide during this month, made so difficult last year during the coronavirus and also again this year. Since we're on Zoom, fasting during this meeting is assured, and we could all do well to think of the meaning of Ramadan. But something else overruled my plans on Ramadan. It was news today that I heard over the weekend and was confirmed in today's paper. Hard to do this. Meadowwoods Health Pavilion will close. Ramadan includes many themes, but one of them is mourning. Just as the Lenten season encourages Christians to mourn their sins and think of suffering, so does Ramadan. I bet everyone here has some knowledge of or acquaintance with Meadowwood. If not, I'll be surprised. I used to go there every few months and give a Sunday afternoon meditation, or really it was more like a sing-along, along with our member Wendell St. John and his dear wife Shirley. Just think of all the losses that we have sustained here. Don't count the ones in Washington, Minneapolis, and Knoxville, just here. We've survived them in the past here, but we have some pressing ones now. Not meeting together in person is a great loss. Let's admit it. Think of all the concerts, gatherings, art we have missed. I think of two other things that I've missed, just representative of the losses in this town. You think of your own. I think of the loss of the poorhouse on Kirkwood, a decade-long venture and reaching to everyone, but especially IU students. I also mourn the closing of Macy's, where I could easily drive up to the top level in the back and get my delight at their latest sales and markdowns, all in the men's section. We've all lost friends. I'm thinking of just one here, Randy Bridges, but you have all lost others. So what do we do with these losses? Charlie Brown in the comic strip Peanuts called it good grief. Yes, we have to face our losses, not deny them, for there to be good grief. I found this little book easily on my diminishing bookshelf and pulled it down to read. It's 60 years old, but it tells us how grief can and should be eventually good. Joy Harder has taught us how to deal with loss, and facing its reality comes first of all. So I'm asking you to do that today. Take just a few more moments for a real reflection. Reflect today on our losses as well as our gains. Thank you.
Thank you for that reflection, Tim. And I hope that we'll all take a few more moments in the coming weeks to reflect on that and to sit in grief that becomes good grief. Thank you for that, Tim. I would like to now introduce some guests with us today. We have Randy Wheeler, I believe. Are you here, Randy? There he is. Hi, Randy. Welcome. And Leslie Green, did you have a few guests that have joined us today?
I do. Thank you, Ashley. I'm pleased to introduce you all to Dan Rodrigo, our Stone Belt Board President, who's joining us today. So thanks, Dan, for joining us. And also glad to have you meet Bida DeWeese, who's visited us before, and Susan Horde. And they are both executive level leaders here at Stone Belt. So glad they could join as well.
Welcome to you all. We hope that you'll join us again. And is there anyone else that I've missed? Looks like everyone else is a Rotarian with us today. But for our guests, if you want to know more about Rotary, please ask any one of us, especially Leslie, and she'll give you more information. Okay, thanks to our producers, Natalie Blaze, Michael Shermis, Sally Gaskell, and Aaron Davis. Roundabout reporter for this week is Susie Graham. Thank you for reporting for this meeting today. We have a few birthdays. Today, Megan Neese and Kay Leach on April 15th. Membership anniversaries. Marilyn Wood has been a member of our club for 6 years. Thank you so much for being a board member and being a part of this Rotary family. And Hal Turner has been a member for 10 years. So thank you so much. We have a few announcements. Beacon, our last quarter speaker recognition recipient, is hosting its Solidarity Sleep Out, with teams sleeping out on April 30th to raise funds to support a friend's place to provide overnight shelter for those without. Rotarian Von Welch is participating. You can head over to their donation page that we'll put in the chat here and add to the roundabout to support the cause. District grant announcement. The Community Service Committee has deliberated, and our 2021-2022 district grant project has been tentatively selected. We will be supporting the Lotus Education and Arts Foundation's Lotus Blossoms World Bazaar. The project is still subject to district approval before it's finalized, and we'll have many more details to share on how we can get involved with the project once it's formally determined. But congratulations to Lotus. We're so excited to partner with them for this next year's grant. And thank you so much to the Community Service Committee for selecting this project. We had several very, very wonderful projects to choose from, and this one met all of our criteria. So we're pleased to work with them. Remember to register for the district conference. It's this Saturday, April 17th from 10 to 2 online. There's going to be quite a few speakers there that I'm sure will be engaging. You'll learn more about the district and Rotary overall. And I'll remind you one last time, the club with the highest attendance will be entered to win $1,000 towards a service project. So we're hoping we can have a pretty good percentage of attendance there. You should have received an email from the district with details on how to register. If you need assistance, please let me or Natalie know. All right, Happy Dollars. It's time to share any moments of celebration that we have today.
Can I? Ashley? Hank?
Yes, go ahead.
I like to donate 20 Happy Dollars. After much planning, a long-awaited visit of our grandchildren and their parents happened. Yesterday afternoon, we drove 2 little kids and their parents home here to Bloomington, and they're going to be with us for quite a while. We are as happy as a clam. So I'm happy to donate $20 to Teachers Warehouse. Thanks.
That's wonderful news, Hank.
This is Liz Speidel, and Al and I made it into our new home last Friday. Whoopee!
Oh my goodness, congratulations. Bill Perkins.
Yes, thank you. I'm happy to let you know that our very first great granddaughter was born last week in the Indianapolis area. Mia is her name. And so that's our second great grandchild, both in the last year.
Wow,
$10, please.
congratulations.
$10, please.
Welcome to Mia.
Okay. Hi. Let me.
Go ahead,
this is-
Charlotte.
Okay, I'm going to give $8 happy dollars for the fact that I walked around the block yesterday, all the way around the block.
Woohoo!
Major accomplishment.
Any other happy dollars? Guests are welcome to share as well. If you have anything you'd like to
I've
share.
got one I'm willing to share. I'll give 10 happy dollars on behalf of the fact that I'm going to get to hug my sister in Nashville, Tennessee, this weekend. I've waited my 2 weeks post second dose of vaccine, and she's fully vaccinated, and so I get to hug somebody outside of my immediate bubble. Hooray.
Yay.
That's great. All right, I have one.
Go ahead, Hal.
I have 10 happy dollars for this moment in American history. In 1775, the second Earl of Guilford, who's Lord North, he was the Prime Minister of England during most of the Revolution. And on this day, he passed the New England Restraining Act, which prohibited American colonies from doing business with anyone other than Britain. And it was one of the precipitating factors for the next year's Declaration of Independence. So thank you, Lord North, for pushing us over the edge.
Is that a picture of him in your background, Hal?
That's me at Woodstock.
Okay.
Yes, that is him.
Any other takers for happy dollars? Last call. All right. Well, thank you for sharing all of those wonderful updates with the club. That's one of the highlights of my week every week. So thank you for continuing to share those. And without further ado, I would like to introduce Leslie Green, who will introduce our speaker.
Thank you, Ashley. I'm delighted to introduce you all to Amy Hewitt, who has a PhD with an extensive background and work history in the field of intellectual and developmental disabilities. She's worked in various positions over the past 30 years to improve community inclusion and quality of life for children and adults with disabilities and their families. At the University of Minnesota, she is the director of the Institute on Community Integration. Amy is a native of Bloomington, daughter of the late Amos and Margaret Hewitt, owners of Hewitt Drug Store that operated in the Courthouse Square here in Bloomington for many years. Besides all that, she's a great friend and colleague to me, and she also is the preeminent expert in the area of direct support professionals. So you are hearing this information from the person that knows it the best. And so I will let Amy take it away.
Thanks so much, Leslie. Thanks for inviting me. It's the first time I've ever presented to a Rotary group. So it's good to be with you today. And in a strange twist of fate, I'm actually in Bloomington, not in Minneapolis, Minnesota, where I'm from. I'm here to attend a funeral of a dear friend this afternoon. So if you had been meeting in person, I would have been able to be with you. I should share that before I get started on my presentation, that I started my career at Stone Belt Center, working side by side with Leslie as a direct support professional. And so my career path really started there when I was a student at IU and did a work study at Stone Belt and just loved that work and have been in it ever since. So that's kind of where I started. I'm going to tackle the screen share. It should work. When Leslie contacted me, she asked me to just talk generally about who these workers are, their importance in your community and in communities all across the country, and to share a little bit of data with you about what's happened to this group of employees, workers throughout our country during the pandemic that we've all been hearing about and living through now for getting close to a year and a half. So I'm going to talk for about 20 minutes, and then hopefully you'll have a lot of questions for me. Let's talk just a little bit about who this group of workers are. They are individuals who choose to work in supporting people with all different kinds of disabilities. So, think about your neighbors, think about your family. Do you have neighbors, friends, families who have children with autism, children with epilepsy, cerebral palsy, maybe a physical disability? This group of professionals choose careers in supporting individuals to have good lives in the community, and individuals that have different needs and different supports and need a little bit of help to do things like learn to play the guitar, or do things like have a job in the community, maybe working for one of your employers, or maybe being included in a program at a local library. That's what this group of professionals do. They're really the key to quality services. So our government spends about $82 billion across the United States in an infrastructure of long-term services and supports for people with disabilities. And increasingly, we have high expectations of programs like Stone Belt and other disability-related programs across the country, that they achieve certain outcomes for people in their lives. Things like employment, things like equity, things like being able to have a job in the community, to ensure that people's rights are upheld. And it's direct support professionals who do that work. We know that there are about 1.5 million who support people with intellectual and developmental disabilities across the United States. If you extend that to the aging community and people with physical disabilities, it's about 4.5 million. And to give you context for that, there are more people in this workforce than there are in nursing, than there are in teaching, than there are in firefighting, police, and EMT services combined, than there are fast food workers. So it's a very large workforce that most people in our country don't know about, and that your children and grandchildren aren't learning about in their secondary educations and even earlier. So it's a very large workforce that we depend on. It's a very highly skilled profession. And so the way I think about what direct support professionals do, in a fancy way, I call them interdisciplinary professionals, meaning that they do bits and pieces of a lot of jobs that you're aware of. So you all know who teachers are. Direct support professionals do a lot of teaching. You all know who nurses are. They do a lot of nursing care. They pass medications, they give treatments, they do positioning, lifting, and transferring, all things that highly skilled nurses do in hospital settings. They're a bit of a psychologist. They counsel people regularly. They're a bit of a dietitian. They make sure that people are getting proper nutrition and eating foods that are prescribed in specialized diets. They help people exercise. They help implement treatment that physical therapists, occupational therapists have prescribed for people. So altogether, they have to have a lot of skill in order to do their work well. If you think about organizations like Stone Belt and other disability organizations across the country, they're trying to do this work with an infrastructure or a system that hasn't caught up with or supported the workforce as community supports have exploded. So they're trying to have outcomes for people, but they're faced with half of their workers leaving. In a typical organization across the country, the turnover rate's about 51%. So of the people who were there to work, supporting people on January 1, a little over half are gone a year later. And you can see that many of those individuals leave within the first 6 months of their employment. Most of the vacancy rates, if you look across, we kind of divide that in part-time and full-time because there are a lot of part-time workers in this field. The vacancy rates for part-time workers is 18% and for full-time workers is about 15%. That is more than quadruple what it is in a typical business and industry. If you look across all the businesses that you guys have been employed in throughout your lifetimes, the vacancy rates and positions aren't anywhere close to these vacancy rates. And if you look at how long people have been in their jobs, about half of these employees are highly committed to the work and stay in it for years. I'm sure that Leslie's a really good example of that. I know she's been at Stonebelt for at least 30 years. So people, a good portion stay in the field, but about half of them leave it. A big part of why is that as a country, we haven't chosen to pay people higher wages. These positions are funded through both the federal and state government, and in some cases, depending on the organization, through donations that that organization might receive, but they're by and large government funded positions. This data is from 2018, and you can see the overall wage is right around $12 an hour, and the starting wage is about $1 less than that. I love this slide. It's getting outdated because the data only tracks to 2017, but it basically shows the wages are stagnant. And when you adjust for inflation in most of these occupations that kind of align with who direct support professionals are, we haven't kept up with inflation over time. And while these workers are offered health insurance benefits, not a very small percentage of them actually take it up. So, you know, health insurance is very costly. And while 70%, almost 71% are offered it, it's usually around about 30 or below percent of these workers who actually take it up. What that means is about between the wage and access to benefits, about half of this workforce relies on other government funded programs, whether that be housing assistance, nutrition assistance, electricity assistance, or health care. They're getting supplements in benefits. Oh, what is going on? So I want to share with you just a little bit about these two studies that we've done at the University of Minnesota that give you just a little glimpse of the importance of this workforce during the pandemic. We've done two surveys. The first was launched in March of 2020, right at the beginning of the pandemic. We did a 6-month follow-up, so I'll share that data with you today. And then in May, we're launching a 12-month follow-up that will include some different information than we've gathered in the past, including access to vaccinations. So we surveyed about 9,000 DSPs across the country, replied to both our first and second survey, which is the largest sample ever of a survey given to this workforce. And they worked in a wide variety of settings. So I just wanted to make sure you understood that they sometimes worked in a group home, sometimes in an employment site, sometimes in individual and family homes, which are common places that direct support professionals work. If you think about this profession, just think back to teaching, nursing, psychologists that are very dominated by females. And this workforce is no different. Nationally, about 83% of the workforce are female. The Indiana data in our surveys have that at about 88%. The median age nationally is 45, and in Indiana, 43. It's in aging and physical disabilities, the industry is far more diverse than it is in intellectual and developmental disabilities based on our recent research. And we're trying to figure that out, but it is more diverse than most workforces. We think often of this being an uneducated entry-level workforce, and it's just not true. 73% of these workers have education beyond high school. One of the questions that we asked was, are you an essential worker? And while nearly every DSP that we communicated with and who responded to our survey said that yes, they were an essential worker, their states and the federal government didn't necessarily identify this group of workers. In fact, only 17 states identified direct support professionals as essential workers in our communities. And the overwhelming majority of this workforce felt appreciated by their organization. In our study, which would be more recent data than the national trend data that I shared earlier, national wages, the average was $13.92 nationally. Indiana fares a bit lower than that at just under $12 an hour. Nationally, 30% of this workforce receives some kind of augmentation or bonus pay to their salaries while working as a essential worker, and in Indiana, 19% did. There was really no structural way other than through PPP loans that providers of disability services could access additional money to pay this workforce more. And so you have these individuals who in a minute I'll share with you like how hard their work got during and remains during the pandemic. You know, you're comparing them to people who work at your local Target who are getting $3 an hour more, or at your local hospital who are getting pandemic pay. And this workforce by and large did not receive that supplemental pay. Of those that did receive supplemental pay, the majority of them, if they did get supplemental pay, it was somewhere in the neighborhood of $1 to $2 an hour, with another portion getting up to that $3 an hour. So it was typically lower than in other industries. And they had to sacrifice a lot. This information is really just about what happened to scheduling and staffing. And people had to work more hours. People had different roles, different responsibilities. You see that got far more significant over time. And many were working different shifts, had to move from working in an agency-based program to delivering services perhaps remotely or at another site, or living inside of a group home to try to reduce the exposure for people. So they had to sacrifice a lot in their day-to-day life. 55% said the locations nationally had been adequately staffed, and that if the people that they were working with displayed symptoms, they were guaranteed paid time off. Only about half of people reported that. By and large, they worked in settings where there were adequate supplies of PPE, where they were able to participate in training around how to appropriately use PPE, and they had information and resources about COVID-19 available to them. That was pretty consistent nationally and in your state. This is an interesting, we asked this in our 6-month follow-up to say, well, is your work and family life, you know, everything you're balancing getting better or worse? And you can see that there were differences in how people responded. A large portion of people said that life was getting worse, and a number of people said it was about the same. Some people thought it was way worse, and a very small people thought it was better. One interesting thing I didn't include on here is that people who were from diverse racial and ethnic backgrounds were much more likely to report that their work life was getting better. And I think we need to understand a little bit more about that. Was that because they were working more hours? Most of them were. And learning more about that kind of disparity and equity issue, I think, is going to be important for us. This is where I think it gets really important. Is we asked how many people had been exposed to somebody who tested positive for COVID-19. And you can see that a pretty significant percentage of people in this workforce had been exposed to somebody who had COVID-19. Interestingly, they were much more likely to be exposed if the person was receiving services, for example, in a group setting, a group home, or some other group setting. We also asked, well, why did people leave their positions during the pandemic? And you can see a wide variety of reasons that we asked about. They're just it's pretty congruent between Indiana and nationally, but many people left because they didn't want to get infected. Many people left. A good portion of this workforce, well over half of this workforce, are primary wage earners and single parents. And so you can imagine trying to adjust to your children not being in school, you not technically being identified as an essential worker, and challenges around that. We also asked a series of questions about the impact of COVID-19 on people they were supporting. And what's important there is for you to understand, okay, things changed for the people they were supporting, so therefore things changed for the workforce. So we asked the number of people who had been diagnosed, number of people who they were supporting who had been diagnosed, and trying to, sorry, I'm trying to maneuver this screen so I can see it. You can see that most people had worked and supported no people who'd been diagnosed. About 18% had worked hand on hand with one or two people, about 12% 3 to 5 people, 6% 6 to 10 people, and 5% of the workforce had worked with 11 or more people who had been diagnosed with COVID-19. So the point of this slide is they're taking big risks in their life of getting infected themselves because they're providing hand over hand kind of work with people who had been diagnosed. Again, the larger the setting in which the worker was employed, the more likely.
Up to 1 in 5 survivors of meningitis will have lost.
We also asked questions about how hard it was to support people in social distancing and the ability to do that. And you can see that, a fair number, a little over 40%, 50%, said it's kind of challenging to support people in remaining socially distanced. This slide is really important, again, because it says, how did my work change? And there are some important changes in the people that were supported that would make work life harder for individuals who choose this as a career. So some people experience pretty challenging increases in behavior. We all have struggled to live without social interaction, without our relationships. Many of you were celebrating with your happy dollars, being able to hug somebody again, increased mood swings. Those kinds of challenges made work for this workforce difficult. So that's just a quick glimpse of the data that we collected. And I wanted to kind of end my formal part of this before we get into Q&A, just talking a little bit about the value, visibility, and status of this workforce. And then perhaps we can talk about what individuals like yourselves can do to improve the value, visibility, and status. So our study showed that people in this role definitely see that they are essential. They're totally essential workers. About 75% said they feel very appreciated by their employers, but only 30% received extra pay, and it was less than that in Indiana. In terms of visibility, I want to share this quick video with you. This is from the perspective and voice of direct support professionals.
I'm not shocked that we're not being seen as much as essential employees, even still during this, because we're never seen as essential employees, because we're never seen, period, because we're in these isolated, sections or systems or group homes or homes, private homes where, we have to stay apart. The complexities of the lives of the people that we serve, don't allow us time to be out there in the world for everyone to see us and know who we are.
That just gives you a little glimpse of one worker and how she's feeling during COVID.
I'm not shocked that we're not.
Another thing is just status, and you probably saw around Bloomington and surrounding areas signs, heroes work here, or heroes or essential workers, thank you for all you do. And that's great, it helps, but what really gives people status in this country are things like the ability to live and to have a living wage and not to worry about paying your bills, education. Those kinds of things tend to bring status, and we can leverage, I think, what this workforce has gone through and done during this pandemic to try to bring even greater status to this profession. The workers know how important they are, their employers know how important they are, but it's people like you. You have to begin to see direct support professionals in the same way you see teachers, nurses, doctors, lawyers, social workers, other professions, in order for our communities to really embrace and in order for public policy to shift to really bring the value, visibility, and status to this workforce that we need. With that, I'm going to leave you with the web link that you can get on and see the Indiana specific report that we've done and see the first and second studies we've done. And by the end of June, you should have access to the 12-month that include information around vaccinations and reintegration back into the community for the people supported and their workforce. So I'm going to stop here and just open it up for questions, comments.
Amy, could you talk a little bit about the association between the pay rates and the resources that pay for them, and why public policy is so important?
Sure, I sure can. So the largest payer for all of these services is Medicaid. That's a federal program. The entire program, the simple formula, it's not quite this simple, but the basic way to explain it is half the money comes from the federal government and half the money comes from state government. And so in order for rates to be raised so that wages can be raised, Congress and local state legislative bodies have to have a fiscal note attached to those increases. So it's like 95, 96% of the funding for the programs that people receive services in if they have a disability, and then the workforce that supports them come from this one program. And so the engagement of community to let elected officials know how important this workforce is critical. It's no different than education, where education, a much smaller portion comes from the federal government, but the rest is funded by state and local, depending on the state and the structure. We depend on government for some services, and this is one of them. And the only way to really increase the wage is by appropriations. It comes down to that.
I have a testimonial. Can you hear me?
Yeah.
Yeah. I'm Charlotte Zitlow. I've been very active in supporting direct support professionals for many years, but now I'm in a position where I need support. And I'm very fortunate that I am able to afford privately to fund my supporters. I have some wonderful people working for me. Very fortunate to be able to do that. I feel as if I'm an employer now. You know, I'm contributing to the economy by paying these people. But my life is, I'm able to live the life that I want to live because of these people who are just very skilled and very able, and probably as I work with them, able to do things out in the world that would earn them even better pay, much better pay, and more respect. Although I must say, people have learned to know my support group, and but it's a major change in my life and a different perspective, and I think that we should all be cognizant of it. These people are really wonderful. They have skills and knowledge that I've learned a lot by working with them, as I've survived a stroke and a choking incident, and now I'm more or less confined to my condo, but I get out because of them. So I'm very lucky, and I think we need to understand how wonderful this it's another group of people. I mean, it's another world in a way. But I testify that I'm very lucky, and that there is this group, and we should support them. Thank you.
Charlotte, I think you bring up two really important points. One is that eventually you'll be affected. Eventually you yourself or a family member will need the support of a direct support professional. And once you are personally affected, you see it, you understand it. And what we really need to do is proactively let people know you will need this, and you need to respect it even before you need it. That's a really important thing. And also just keep in mind, most people can't afford private pay.
Absolutely.
And so they rely on what Medicare, Medicaid will pay for. And it's a very different reality.
Yeah. Yep. And it should be expanded. I mean, more people should be able to get this kind of care, even if they don't have husbands who've worked hard. And I worked hard, but I never earned any money. But yeah.
Other questions?
Okay, now you can.
Okay. John?
Yes. How will if it does pass, the minimum wage, the raising of the minimum wage to $15 an hour, or whatever it ends up being, how would that affect Medicaid, people that are paid through Medicaid?
You bring up a really good question, John. And what I've seen happen in other states is this is often overlooked. And so it makes it much worse for this group of employees, because often Medicaid funded programs are carved out because the fiscal note attached to having to increase their wages to $15 an hour is significant. And so I could name you 5 or 6 states where minimum wage laws, or even at the city level, you know, in Minneapolis has a $15 an hour minimum wage, but nothing happened at the state level to ensure that rates would be increased so that people in this business could afford to pay the $15 an hour minimum wage. And so it's very common in Minneapolis. You know, my son makes $17 an hour working at Noodles and Company, but direct support professionals make $12 an hour. and the jobs just are not comparable. And so from a policy perspective, it's really important to stay on top of it and make sure that this industry is included in those provisions in new law.
Anne?
I'd like to know if the supplemental security program is a help in the providing for people, especially in the group homes. Isn't that a source of revenue?
It is, but that usually offsets costs of room and board for people. So it's not the service provision of the staff who are hired to deliver hourly supports and services.
Oh, I see.
So it doesn't go to staff wages is another way to say that. Sally?
Amy, forgive me if you mentioned this at the beginning, but what kind of training do direct support professionals receive? Do they receive it at the beginning of their work? Are there professional associations that help them keep up with new trends? What is that like?
So there are no federal training requirements or prerequisites for this. States have statutes usually that identify what training is required for somebody to work with individuals with intellectual and developmental disabilities. Those are usually topic driven. And if I were going to aggregate across all states, it's about 40 hours of training that somebody gets, most of it upon hire. Very few, no state requires any kind of pre-service. You have to have this credential in order to become a direct support professional. Some states have mandatory training requirements, but if you average that out, it's about 40 hours, and it's a mix of now online kind of didactic training and in-person on-the-job training. And then usually there's a requirement for annual in-service training. A lot of times that's just going over required training, like refresher courses. So not nearly enough. If you look at the competencies that are required, competencies and skills required of this workforce, we know minimally it's about 240 hours of training that is needed to teach people everything they need to know to be good in this profession. And what happens is they learn that stuff over time, hands-on, instead of like a nurse or somebody who goes to school to become. You can't expect somebody to pay for even a 2-year degree and land a job making $12 an hour. The economics of that don't add up, but it's what's needed. So if you look at any female dominated profession, the wages were extremely low until certification, credentialing, education became a requirement, and then wages went up.
So is that something that the profession is looking toward?
It's interesting, I've been at this for a good 25 years trying to find solutions to these problems that have existed. It's what needs to happen. There used to be just flat out resistance to it. It's embraced now. It's embraced by the industry to as long as it's not an unfunded mandate, it's embraced by the industry. It's about trying to leverage legislative support at that state level to make it happen.
Yeah.
And there, I forgot to mention, there is a professional trade association for this group of workers. The reality is that it's mostly their employers that belong, not the workers. It's called the National Alliance for Direct Support Professionals.
Anne Wren had a question, but you're muted, Anne. While she gets that sorted out, Sarah Laughlin was next. If you wanted to ask your question, Sarah.
Yes, I just got my copy of the ARC newsletter, which I understand to be an advocacy group for direct support professionals and these professions. And I just wanted to know, what can we do? To call to is there a bill? Is the legislature working on something now? I know it's a budget year. Is it too late? Is it, what should we do in Indiana or federally?
So I'll let Leslie answer your question at a state level about any general legislation that's happening here. Federally, you likely saw that the new administration just put out and included in their big infrastructure push to include this workforce and caregiving in general. And so I think just watching what happens with that infrastructure bill will be important, and just letting elected officials know that you do see caregiving as a component of infrastructure in our country, because it is. Without it, nobody can work, or many people can't work. Leslie, do you want to address any state level?
There's some potentially good news for us that the state budget, which will be passed sometime between now and the 21st of this month, it does include an appropriation for increasing DSP wages. It brings them to an average of $13 an hour, which is an improvement, but I just was reading Indiana University's plan to raise their minimum wage to $15 an hour. So we're still going to be behind some of the wages in this community. But if you're interested in supporting that and letting your state legislator know that you support the direct support professional wage in the state budget.
Mm-hmm.
And if you have a question, you can go ahead now.
No, but Glenda Murray has a question.
Go ahead, Ann.
Ann's done.
Okay. Actually, Raj was next, and then we'll close our program and come back for Glenda if we can. Raj, go ahead.
Amy, thank you for a wonderful presentation. I gather from what you presented that most of the disabled individual you address inflicted in some physical handicap. I did not gather much about the mental disorder of some of these individuals. And as you know very well now, that both alcohol and drug addict consider an illness, a disease to be proven. Could you please elaborate a bit on the mental side of your presentation, if you covered any?
Sure, I'm happy to. We sort of in this country separate out disability services and mental health services. Now, not in all cases, but there is a different mental health system that supports people with addiction and with mental health disorders. About a third of people who have intellectual and developmental disabilities also have a co-occurring mental health disorder. So, for example, somebody with autism, it's very highly likely that they also have depression and anxiety or OCD. So there is a significant overlap. The group of workers that I included in this presentation would not be considered working in the mental health industry. They have challenges in the mental health industry as well, but their salaries are quite a bit higher, and their turnover and vacancy rates are much lower on the mental health side.
Thank you, Amy, so much for this presentation.
You're welcome.
Do you have a few moments to stay after to address any additional questions? Thank you. Okay, in honor of your presentation today, we will be making a donation to Monroe County United Ministries, which is our new quarterly recognition recipient. And Sally, will you tell us about next week's program?
Absolutely. Next week on Zoom, April 20th, we're going to be learning about the 1 Trillion Trees Initiative from Will Burns of Northwestern University. Join us.
Thank you. All right, let's recite the 4-way test together and we will get back to some questions. Of the things we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, goodwill, better friendships. Fourth, will it be beneficial to all concerned?
And is
Is it fun?